Good morning, everyone. Thank you for joining us for the Hudson Medicare 101 Educational Workshop. My name is Shah Galstian. I am a licensed health insurance professional and also a licensed financial professional with 26 years of experience in the financial services industry. I commend you all for being here this morning because we will be discussing something very important to all of us, which is our health insurance, and in this case, Medicare. So for those of you that are turning 65 or are 65 or older, this should be a very educational presentation for you. A few things before we begin. First, you'll see at the right of your screen, there is an empty box there. That is a chat box. So throughout the presentation, if something comes up and you want to ask a question about it, or just any general question if you have, or specific question, feel free to type in your message in that. It'll go in that chat box and I'll see it and I'll stop and I will do my best to answer your questions. I've been doing this long enough to know that I can't know everything. So if I don't know the answer, I promise you I will get you the answer. And also you'll notice at the top of your screen, there is a red box. It says schedule on it. What that's for is if you would like to schedule an appointment one-on-one with me to discuss your individual circumstances, your unique circumstances related to Medicare and your healthcare, then feel free to click on that button, which will take you directly to my calendar, where you can schedule a date and time that is convenient for you, and we can discuss one-on-one, either by video, the way we are now, or by telephone, okay? So the agenda for this morning is, first we'll discuss the 4 parts of Medicare: Part A, Part B, Part C, and Part D. Then we'll discuss the gaps in Medicare. You may have seen the commercials that say, the Medicare commercials, right? They say, Medicare pays 80%, the rest is up to you, right? So we'll discuss those gaps and we're going to discuss options to cover those gaps. When to enroll in Medicare, which is important as well. And of course, finally, how to choose the best strategy for you. Starting with Part A, that is your hospital insurance. God forbid you ended up in a hospital. Part A of Medicare is hospital insurance. Part B is medical insurance, which is outpatient, out of the hospital insurance, meaning your doctors and your specialists. Part C is something called Medicare Advantage plans. Now, you may have seen commercials about this, especially in the fall, and received a lot of mail on it too. Medicare Part C is Medicare Advantage plans. So these are private insurance companies, unlike original Medicare, which is just Part A, hospital, and Part B, doctors. So Part C are private companies, which consists of HMOs, which stands for Health Maintenance Organizations, and PPOs, or Preferred Provider Organizations. Provider means doctor, so Preferred Doctor Organizations, if you will. And they include, like I said, Parts A, the hospital insurance, and Part B, medical insurance, and often a lot more, which we'll get into. And finally, Part D, which is prescription drug coverage. Part A, hospital care. Okay, there are no premiums for Part A. Now that's assuming that you've worked at least 10 years or more, or you're covered under your spouse's or your partner's group health insurance plan. If you've worked less than 10 years and you're not covered under a group plan with your spouse or partner, then you'll have to pay a premium depending on how long you've worked. And I can discuss that with you one-on-one. When it comes to the first 60 days of hospital care, so if you're in the hospital, the first 60 days are covered 100% by Medicare, Part A. The first 20 days of skilled nursing are covered 100%. People ask me, what's a skilled nursing facility? That means, for example, God forbid, let's say you broke your leg or you broke your arm and you ended up in a rehabilitation center. That is considered a skilled nursing facility. And again, Part A of Medicare covers the first 20 days, 100%. Part B, medical services. Now, again, this is your outpatient, out-of-hospital healthcare, your doctors, your specialists. $148.50 per month is what we all have to pay. Some of us may have to pay more depending on our annual income or our joint annual income if you're married or have a partner. And I'll get into that later as well. But the base monthly premium for Part B is $148.50. And there's a star next to it, there's an asterisk next to it. So if you go all the way down to the bottom, you'll see the little fine print there. For 2021, the standard Part B premium amount is $148.50 or higher, depending on your income. And by the way, all the numbers I'm going to be showing you this morning, they're all 2021. So this is the latest information. Okay, getting back to the Part B medical services, it covers medical services outside the hospital, including doctor visits, lab work, x-rays, ambulance. You'd be surprised how much an ambulance ride costs these days. Emergency room, and outpatient surgery. An 80-20 plan with Medicare paying 80%. That goes back to the commercial, right? Medicare pays 80%, the rest is up to you. And Medicare Part B healthcare services have a $203 annual deductible. So the first $203 is coming out of your pocket before the Medicare Part B kicks in. Let's talk about the income brackets, if you will, when it comes to paying your Part B premium. Again, Part B is your doctor and specialists, right? So if you look at the top left corner, it says, my joint income is. So this is joint income, married or with a partner, $176,000 or less annual income. Your monthly Part B premium is $148.50. And if you go on to the right, it goes up the scale. For example, the next one to the right is if your joint income is $176,001 up to $222,000 per year, then your monthly premium for Part B is $207.90. And if you go all the way to the right, if your joint income is $750,000 or more, your annual Part B premium is $504.90. So go back all the way to the left and down, and we'll see individual. My individual income is $88,000 or less. Again, this is all 2021, this year's numbers. $88,000 or less in income, $148.50 is your Part B monthly premium. And it goes all the way up to the right. If your individual income is $500,000 or more, your Part B premium is $504.90. What you don't get with Parts A and B. So if you sign up for Original Medicare, which again is Part A, your hospital insurance coverage, and Part B, your doctors. If you sign up for Part A and B, Original Medicare, you don't get dental coverage. You don't get vision coverage, eyeglasses. You don't get prescription drug coverage. You don't get hearing coverage, such as hearing aids. And you don't get covered for long-term care. Now, people ask me, what is long-term care? Long-term care is a type of insurance for those who don't want to end up in a nursing home and instead want to stay home in their house and have private nurse care coming to their house. And that's extremely expensive on a day-to-day basis. It can range anywhere from $300 to past $500 per day. And there's an insurance for that. It's called long-term care insurance. So basically what we're saying here is that Original Medicare does not cover long-term care. When can you delay Part B? In other words, there are certain circumstances where you don't have to sign up for Part B and pay that Part B monthly premium that we just discussed, okay? You are actively employed and covered under an employer health plan. So if you're still working and you turn 65 and you're covered, then there's no need. You can delay Part B without a penalty. And I'll get into the penalties as well, because that's important, and we don't want you to pay any penalties. You are covered, or if you are covered under a spouse's employer health plan, you'll have no penalties for enrolling late if you decide to delay the Part B enrollment to a later date, and you'll have no loss of the Medicare options. Retirement. Now, where do you go? All right. Let's say you're retired and you're deciding on something other than your employer's group health insurance plan, if you had one, or even if you did, and you're saying, you know what, I might get something better. And oftentimes you can. Should you go to the left, which is an employer group health plan that you already have, or your spouse has? So in other words, do nothing. Should you go straight and take the original Medicare option, which is Parts A, again, your hospital coverage, and your Part B, doctor coverage, along with a Medicare supplement plan? See how it says supplement next to the arrow? A Medicare supplement insurance plan is a plan that covers what Medicare doesn't cover. That goes back again to Medicare pays 80%, the rest is up to you. So the Medicare supplement plans cover what original Medicare doesn't. So are you going to take a left and stay with the employer group plan if you have one? Are you going to go straight to original Medicare along with a Medicare supplement plan to cover the gaps? Or are you going to go to the right and go with a Medicare Advantage plan, which again covers Part A, hospital insurance, Part B, the doctors, and many other things, often depending on the plan, including prescription drug coverage. And I'll get into that in a moment as well. And we'll make a nice comparison of all of this, because that is the ultimate decision. Retiree or union plan. If you have a employer group health insurance plan, these are questions you need to ask in order to decide, should I stay with this plan or should I consider original Medicare or a Medicare Advantage plan? Are there co-pays and deductibles? Co-pays, as you may know, are as soon as you walk into a doctor's office or a specialist's office, boom, you may get hit with a co-payment. It can range anywhere from $25 to a little over $50, sometimes a little more, depending on the plan. So are there co-payments and are there deductibles? Meaning, is there a certain amount that's coming out of my pocket before the coverage begins? Does it include a drug plan? Very important. If I opt out of the employer group health insurance plan, can I opt back in at a later date? And that's important too, because you may go through a plan and decide, oh, this isn't really right for my unique circumstances. I want to go back to my employer's plan. But some employer plans, once you leave, they don't allow you back in. It's a one-way street. What is the cost, right? You can have the best healthcare plan in the world, but if you can't afford it, then what good is it to you? And finally, does it include a dental and vision coverage? Medicare supplement. Okay, these are insurance plans that cover the gaps that original Medicare does not cover. They're sometimes called Medigap plans. They are federally standardized Medigap plans offered in all states, including Washington, D.C. The plans are alphabetically from A through N. Some cover more than others and may be more expensive than others. And they're offered in most states, and all policies offer basically the same benefits. I don't want you to get confused by the screen or intimidated. I'm going to make this very simple. Medicare supplement insurance or Medigap plans, filling in the gaps for original Medicare, right? If you look first look in the middle of your screen. You see A all the way through N, and look straight in the middle. There's a G, all right? Plan G, Medicare supplement or Medigap plan. This is one of the most popular plans because it covers a lot. So we're going to stick with that Plan G, and we're going to start at the left, under benefits. At the left of your screen, under benefits, it says Medicare Part A, coinsurance, and hospital costs. So that 80-20 rule, where 80% is covered by Medicare, the 20% is up to you. Medigap policy, such as Plan G, covers that co-insurance. It's called a co-insurance because you're both paid. Medicare's paying 80, you're paying 20. It's a co-insurance. So that 20% is covered with the Plan G, and you're paying a monthly premium for that. Going down under benefits, it says Medicare Part B co-insurance. Again, same thing. It's covered under Plan G. It's covered under the others also. But if, for example, you look at Plan K, it's only covered 50%. And again, the premiums vary because of the coverage. Going down further on the left under benefits, you look at the next one, it says blood, right? 3 pints. People ask me, what do you mean blood? It's a lot. It costs a lot of money when they take your blood. And the first 3 pints are covered by a Medigap plan, such as the Plan G. And one down from blood is Part A hospice care co-insurance or copay. Another one down is skilled nursing facility care. That goes back to, God forbid, you broke your leg, you broke your arm, or your back, and you ended up in a rehab center. Medigap plans such as the Part G plan covers the co-insurance for a skilled nursing facility. The Part A deductible, which is $1,484. I didn't come up with that number, by the way. That's the government. So Part A, again, which is your hospital insurance, the first $1,484 is coming out of your pocket, unless you have a Medicare supplement or Medigap plan. And again, this is all under original Medicare. Part B deductible, which is $203 a year, is not covered, but that's not as bad as the Part A. Part B excess charges are covered also by Plan G, if you look at the Plan G column. And for those of you who love to travel, maybe not so much these days, right? But we'll be back after the pandemic. Foreign travel, 80% is covered. These 2 plans are no longer offered. I'll go back if you notice. There's no C and there's no F because they are no longer offered. So we don't have to get confused with that. Medicare supplement plans or Medigap plans. When it's the best path, you want to budget your medical costs. Know what you're paying for when it comes to your primary care physician, if you have one, and specialists. If you love to travel, including second residence out of state, and may need to see a doctor away from home. Original Medicare, you can see any doctor that accepts Medicare. See any doctor or specialist that accepts Medicare. Right, we just said that. Some plans have no co-payments and no deductibles, which is always nice. And no referrals are required. Now we get to the Part C. Remember again, Part A is your hospital coverage. Part B is your doctor coverage. Part C is the Medicare Advantage plan, which covers Part A and Part B, and often has many other benefits. Part C replaces Part A and B and can include Part D, which is prescription drugs. A PPO, or Preferred Provider Organization, and an HMO, or Health Maintenance Organization, they have a network of doctors. They're going to give you a pamphlet, and it'll have a list alphabetically of doctors for you to choose from. And hopefully your primary care physician, if you have one, is in that list. With an HMO, you have to stay within that list of doctors. If you go outside the list, there are some HMO plans that will let you go outside of the list of doctors for care from another doctor that's not in their network for some healthcare services, but you may end up having to pay more. A PPO, in comparison, you can go outside of network and there is more flexibility. This next bullet is very important. Includes a maximum out-of-pocket expense. In other words, on a given plan year, there's only so much that can come out of your pocket before it's capped. For 2021, that cap is $7,550. So if you had a bad year and you ended up spending out of your pocket to that amount, anything over that is covered. And finally, you can choose plans annually. There is something called an annual enrollment period. What is that? Each year, from October 15th to December 7th, there is a window. It's a 7-week window where you can choose a plan or change a plan. So that's called the annual enrollment period. There are actually 2 other annual enrollment periods, which I will mention in a couple of minutes. When it's the best path to go with a Medicare Advantage plan? You're wanting a lower monthly premium. Some of these plans have a 0 monthly premium. I'd have to say Medicare Advantage plans in general, over the past 5 years, if not more, have come a really long way when it comes to the premium, the cost, and the extra benefits. It's used as a backup for the Veterans Administration services. So if you are a veteran, and if you are, thank you for your services, by the way, it's used as a backup for a lot of these special people, because a lot of them don't want to wait in lines. Often there are lines to receive health care from VA hospitals, and they want to have that backup plan. So in that case, it works for them. And if you're on Medicaid, Medicare, if you are Medicaid, Medicare eligible. Medicaid is basically financial assistance. And there are certain requirements, both income and asset requirements, that have to be met in order for you to qualify for that financial assistance. And I'll go over those in just a moment as well. And finally, Part D. So again, Part A, hospital insurance, right? Part B, your doctors and your specialists. Part C, which is Medicare Advantage plans. And finally, here we are with Part D, prescription drug plans. Prices vary by county depending on the plan, and they start at $7.30 per month and can go up depending on your plan. They're included with some retirement plans and some not. Late enrollment penalties may be imposed. If you enroll late in a Part D plan when you became eligible at age 65, there is a 1% penalty per month that you were eligible to enroll. So for example, if you enrolled an entire year late, that's 12 months, that's a 12% penalty, which is worse than the late enrollment for enrolling in Part B when you become eligible, which is a 10% lifetime penalty. So we don't want you to pay any penalties. That's one of the reasons why we're here this morning. And I can help you with that to make sure you don't. Veterans exempted from the requirement to enroll, but may choose to do so. So veterans are exempt from the timeframes involved, but they can if they want to. And you can choose the plan annually, going back to the annual enrollment period, which again is October 15th through December 7th of every year. Extra help with prescription drugs. There's something called the Low Income Subsidy, LIS. You can apply for this. It's financial aid in order to help you pay for your prescription drugs. And the requirements are your annual income has to be less than $19,140 for singles and $25,860 for married couples. Your resources have to be less than $14,610 for singles and $29,160 for couples, for married couples. So basically, if you're driving around in a Ferrari, you may not qualify for the financial assistance. You may also get help with deductibles, co-pays, and premiums, which would be nice. Okay, with the Part D prescription drug plan, there is something called a donut hole. It's a gap in coverage. And I'm going to explain this very briefly. We can go into it together one-on-one, and I'll explain it in more detail if it applies to you. And again, by the way, at any point, if you'd like to schedule a one-on-one appointment with me, just click on that red schedule button at the top of the screen. It will take you to my calendar, and you can choose a date and time convenient for you. The coverage gap begins when you and your drug plan spends $4,130 in a given plan year. Again, I didn't come up with these numbers, the government did, okay? And they always change, but this is all the latest 2021 numbers. So from $4,131 through $6,550, there's a gap in your prescription drug coverage, where during that gap, you're paying 25% of the cost for both generic and brand name drugs. So once you get to $6,500, oh, by the way, 95% counts towards your out of pocket. And that's important because once you get to $6,550 in out of pocket expenses, you get to a stage called the catastrophic stage, or the catastrophic coverage after $6,550. At that point, once you reach that number, your prescription drug costs can range minimally anywhere from a little over $3 to approximately $8 or $9, maybe a little bit more. But that's what the donut hole is in the prescription drug coverage. This is the ultimate slide. I love this slide because this is where you make a decision. Do I go with original Medicare with parts A and B and get a supplement or a Medigap policy to complement it to fill in the gaps? Or do I go with the right side, which is Medicare Advantage plans? So let's do the comparison. This is a great screen. Please stay with me. We're getting to the end. Upper left-hand corner, Medicare supplement plans. Again, this is with original Medicare. It fills the gaps in original Medicare. On the right, Medicare Advantage plans replaces original Medicare. It covers at least Part A and B, hospital and doctors, and more often. The next one down on the left, no prescription drug coverage. There is no prescription drug coverage with original Medicare, just the hospital and the doctors. It can be paired with a Medicare Part D prescription drug plan. So you can have original Medicare with hospital and doctor coverage and obtain a standalone prescription drug plan. On the right, in comparison, Medicare Advantage plans often include Part D prescription drug coverage, which is fantastic. And then we'll go back to the left and go down again to typically accepted by any provider that accepts Medicare. Provider means doctor, right? So original Medicare, you can go to any doctor that accepts Medicare, whereas in comparison, go to the right again, to the Medicare Advantage column. It says coverage is usually network-based, like an HMO or a PPO. Again, that goes back to what I mentioned. They give you a pamphlet or a list of doctors from A to Z for you to choose from. Next one down on the left, it says monthly premiums typically range from $85 to $150, but vary by plan and geography, where you live. So this again is for a Medicare supplement plan or a Medigap plan to complement your original Medicare and fill in the gaps. $85 to $150 monthly premium for this type of supplement plan. On the right, in comparison, Medicare Advantage plan premiums can be as low as $0 per month, but you're still responsible to pay for Part B, the Part B premium. So in order to have a Medicare Advantage plan, which covers A and B, hospital and doctors, and a few other much more benefits actually, which I'll mention. In order to have it, you have to enroll in that Part B premium, the doctor's insurance, which again, if you remember, is at least $148.50 per month, and it depends on your income, which we discussed earlier. So you have to enroll in Part B in order to have a Medicare Advantage plan. We'll go back to the left again and go down one. It says premiums can be affected by age and gender, whereas on the right, your monthly premiums are not impacted by age and gender. They vary by county, where you live, your zip code. Go back to the right again, please, and we'll go down one again. Health questions may be asked to determine eligibility. When you become eligible for Medicare at age 65, right? If you enroll in Part B, that automatically triggers a 6-month window where you can obtain a Medicare supplement or Medigap plan with no questions asked. You will immediately become eligible. It's called guaranteed issue. No questions, no physicals, no blood work, no urine, nothing like that. So you have a 6-month window to do that. Otherwise, there may be questions. Comparatively, on the right, you have guaranteed acceptance with a Medicare Advantage plan, except for those with end-stage renal disease. So we'll go back to the left and one down again. Benefits are the same regardless of which company offers them. Whereas on the right, with a Medicare Advantage plan, benefits vary by company and out-of-pocket costs are capped. So this is important. Remember, with the original Medicare, Parts A and B, there is no maximum out-of-pocket cap. In other words, you could end up spending, if you have a bad year, you could end up spending a lot of money out of your pocket. Whereas with a Medicare Advantage plan, there is that cap, which is $7,550. You can't spend more than that out of pocket. Something to consider. And finally, all the way at the bottom left, enrollment is year-round. So that window that we were discussing, which was October 15th through December 7th, there is no annual enrollment period for a Medicare supplement plan. It's year-round. Whereas on the right, at the bottom, for Medicare Advantage plans, enrollments are limited to initial enrollment periods, annual election periods, and open enrollment periods, as well as special circumstances throughout the year called special enrollment periods. And I'll discuss that in a minute. Okay, here it is. When do you sign up for Medicare? Initial enrollment period. This is a 7-month window. I don't expect you to remember all this, by the way. But this is a 7-month window that starts 3 months before your birthday. So for example, if your birthday is this month, February, then you have November, December, January, that's 3 months, and then your birth month, which is February in this example, right? That's 4 months. And then March, April, May. That's a 7-month window that you have to enroll. The sooner you enroll, the better. Because if you wait till after your birthday, the 3 months following your birthday, your coverage will be delayed. And that's not good. So that's the initial enrollment period. It's called initial. It's because that's when you're turning 65 and becoming eligible for Medicare in the first place. Initial enrollment period. The next one down is general enrollment period. And this is a time frame from January 1st through March 31st of each year, where you can enroll or make changes to your existing healthcare plan. And the only thing with this is that your coverage doesn't start until July 1st. So there's, from March 31st to July 1st, there's a 3-month gap there that you may want to avoid. So that's the general enrollment period. And the third one is a special enrollment period. For example, let's say you move out of the county to a different county, or let's say you move to a totally different state, and that state or that county doesn't have the plan that you currently have. Then you can disenroll in the plan you have and enroll into a new plan. How do you sign up for Medicare? If you're collecting Social Security, it's automatic, which is great. Enrollment is automatic. Your card, a nice little Medicare card, will come in the mail about 3 months before your 65th birthday. If you are not collecting Social Security, you have to sign up for it. You can do that in one of two ways. You can enroll in 2 different ways. Call Social Security and schedule an appointment. There's an 800 number there. Or you can sign up at Medicare.gov, which is a great informative website by the government. So the Social Security number is there. I'll wait a couple of seconds for those of you who want to jot this down. I can give it to you. and Medicare.gov. Have questions. So let me say this, folks, if you will. Let us help you understand the upcoming changes as they relate to your unique situation. The decisions you make can impact your healthcare coverage for a long time. If you decide to call the insurance companies directly, such as Humana, Cigna, Aetna, United Healthcare, and so on and so forth, they're all great people. They're going to give you information about their plans. The difference between them and an independent licensed professional like myself is that we have very sophisticated software that can take all of your unique circumstances into consideration, such as your lifestyle, the prescription drugs you take, where you live, how much can you afford. We can take these considerations and input them and find the best choices based on those parameters for you, and then help you make a very educated and informed decision. And also, let me mention this. You're not going to get a bill from you if you decide to have me help you, okay? You're not going to get a bill in the mail from me. Why? Because the health insurance companies compensate us directly, okay? So again, you're not going to get a bill from me if you decide to let me help you. So with that said, the schedule button is up at the top. If you would like my assistance personally, it'll take you to my calendar where you can schedule a date and time that's convenient for you, and we can discuss either by video or by phone, whatever is comfortable for you. Also, I will be sending each and every one of you something called a Medicare Navigating Booklet, which is a nice summary, puts everything, wraps it up in a nice bow, everything that I just discussed with you this morning. And I will be emailing that to you after the presentation, and I think it'll be very helpful to you. So with that said, what I will do now is thank you for coming. I wish you health, first and foremost. I hope that you make very educated and wise decisions, because this is very important to you, and I understand that. And I will stick around for questions, and thank you again for coming. I hope you have a fantastic weekend. One last thing, ladies and gentlemen, I forgot to put this slide up. My full name again is Shah Galstian. My designation is life. One last thing, ladies and gentlemen, this final slide. My first name is Shah, my last name is Galstian. I am an LUTCF designation, and people ask me, what is that? Because it's not like PhD or MBA, right? LUTCF, you don't see that too often, but it stands for Life Underwriting Training Council Fellow, which means that I'm a specialist with health insurance and life insurance. And that also means that I'm a nice guy. My cell phone number is right there. It's direct to me. You won't be on an 800 number for 20 to 30 minutes waiting for a human being. So that'll go directly to me. And if I don't answer, just leave a message, and I promise you that I will return your call. You have my email there below my phone number and our website. So feel free to contact me. Thank you again.